Daniel Mark, SPINDIAG, fast and easy screening of patients for antibiotic-resistant bacteria during admission.
Well, good day, ladies and gentlemen. It's very exciting to be here. And I will be talking about a huge problem in hospitals in a second. That is patients being infected by bacteria that are brought in by other patients, so-called hospital-acquired infections. And about 500,000 people are infected in German hospitals every year that way, and about 15,000 of these patients die, which is five times the number of traffic deaths we have every year. This problem is likely to only become worse because bacteria are developing more and more resistances against the treatment by antibiotics, which is of course our main weapon in the fight against bacterial infections. So how do we deal with this threat? Well, ideally, when a patient comes in, a doctor would see if the patient is carrying dangerous antibiotic-resistant bacteria. If that is the case, the doctor could treat the patient in isolation and thus greatly reduce the risk of the patient infecting other patients. So we are working on a sort of portable laboratory, which is in the shape of a CD, which contains all the reagents that are required to detect these pathogens, these bacteria. The doctor simply has to insert a swab sample, which is very common in screening procedures, put it into the disc, which is then placed into a large CD player, which is portable and easy to use. And in about 30 minutes, the result is given by a technology called polymerase chain reaction, or PCR, which is common in laboratories, but what we do is we provide them in an easy format, in an intelligent cartridge, right at the point of care where the doctor has the most use out of it. So at the moment, we have shown that even complex processes like sample preparation, pre and main amplification can be automated by this CD and CD player format simply by spinning a disc in this rotary instrument by moving liquids inside small channels, and that can mimic a laboratory complex process very well. And we have shown that by showing a very high sensitivity, which is, well, we've proven that we are basically able to detect basically single bacteria from a patient sample. The technology is currently still in development, and we expect it about 2 years until it's ready for routine use. But when this enters the market, we are hoping this will be our contribution in the fight against antibiotic-resistant bacteria and their spread in hospitals. Thank you.